This video is on chin augmentation, also known as chin implant. The chin implant that I perform, or chin augmentation I perform, is for people that have a weak chin or short neck. A lot of times people say, well, can I do that with a filler? Can I just put some fillers there? And it never just is that great. It's when you put soft tissue filled into the chin, I've done it, but it doesn't give you this durable projection that a chin implant does, because the bone weakness must be replaced with something that's firm and harder so it looks like a projection of chin or bone. And so really only a chin implant suffices. There are different types of chin implants in terms of style. Button implants, short and long extended implants. I only perform long extended implants. There's many reasons why. One big reason is that it creates a very natural jaw contour. And so it's really not just the little chin that's an issue, your whole jaw is deficient. So a longer extended anatomic chin implant is what I use, not a short button. The other reason is that small butt implants shift over times, and that's not an ideal situation. You want it to stay stable for the rest of your life, which this should do. The other thing with an extended anatomic implant is the fact that it really just looks better. I mean, it just looks so much more natural. It looks more integrated into the area. And I do that with facelifts, I do it without facelifts, or just for younger patients that need that. Let's talk a little bit about the style of implant that I prefer. In general, I prefer the contoured style of implant because the contour is very soft and pliable. It actually bends and shapes along the jaw implant better. So it creates a nice contour. I don't like the implants that are too rigid, that create too harsh a look and too much projection. So the Implantech contour implant is what I prefer in most cases for both men and for women. Let's talk about what material is possible. There's silicone, there is Gore-Tex, there is Medpore, and those are the major types that are out there. So I used to use Gore-Tex or EPTFE. I don't use that anymore, and the biggest reason is that Gore-Tex shrinks. Over a period of 2 to 3 years, you actually lose projection. Also, they're very hard to remove if they need to be removed. Medpore, you may have heard about, is sort of a folded implant placed in there. I don't use Medpore or Porex implants because they're near impossible to remove. If you remove them, they tear out all the tissues. It really does a lot of tissue damage, and they have a higher chance of getting infected. In all my years, I've only had one implant infection, and the reason I had it, I believe, is because I did a simultaneous lip correction procedure, which now I don't do together. I spread that apart by at least a month before I do anything, so that there's almost no chance of infection. I do things under very, very sterile conditions. With the chin implant, the silicone implant has a lot of benefits. The first benefit is that it doesn't compress over time. It stays where it should be. The second benefit with the silicone implant is that if you don't like it, it's easy to remove, easy to adjust. If something is not, if you're not happy with it, it's easy to take out or replace or whatever it may be. And the other thing that's great about the silicone implant is that it's very stable. With the encapsulation that occurs around the implant keeps the implant incredibly stable. It should not shift or move or anything, and you don't need to actually sew it in with a permanent stitch. You don't need to put a screw in it. It actually stays incredibly stable. So we're going to talk about the surgical procedure of how do I keep this implant from shifting. So I was at a conference many years ago, and people were talking about how they raise the periosteum and place it underneath the periosteal lining, which is the lining of the bone, all over. I don't like that because, in my opinion, it's not very stable. I do what's called a triplanar placement of the implant. So what that means is the middle portion is above the periosteum, and on the sides it's under the periosteum. I actually tuck it under the periosteum. So the implant has almost zero chance of rotation. It stays very, very stable in this triplanar position. The other reason I like it is that when you look at x-rays after a couple years, you may see that the bony table is slightly eroded back. So people always worry that their bone is damaged. That's not the case. But placing it above the periosteum allows for less bony erosion. If you say, well, that's going to impact my result, no, it actually doesn't, because the implant actually encapsulates. So that difference between erosion and the encapsulation leads to a result which is really no appreciable difference in projection over the years. The other thing that I do with this is that the implant must be placed under the mentalis muscle, so that it's a temporary stitch. So as the encapsulation occurs, also there's almost zero chance for the implant to shift downward. So with the mentalis holding it, also with the temporary suture holding it to the periosteum, is another reason I leave the periosteal cuff there, keeps an implant firmly positioned from motion. The other thing you probably have heard is, let me talk about this, is on the lateral borders, I use a silk stitch to pull through because the outer tails are very flimsy and thin, and you don't want to curl under. So in 20 years, I've never had a curl under. So when I use a silk pull through, it allows that very thin outer edge not to be buckled under. It stays straight. So why would you use something so flimsy out here? The reason is you want the transition from a thicker implant to a thinner implant to mimic the shape of the jawline. If you make it a very abrupt transition, not only is it more palpable or more that you can feel it, but also the transition is not as elegant. So I like this tapered effect going across there. It's very, very nice. Talking a little bit about the nature of the procedure, I do my chin implants under general anesthesia. The reason I like that is that most patients that need a chin implant have a very weak jawline. So if you do under sedation, which I used to do in the past, patients are always like having airway issues, very difficult to do the implant, and then there's risk of infecting the implant because I'm constantly trying to adjust the chin. So that's the limitation of doing it under sedation. I use board-certified anesthesiologist. The procedure is very short, done in about an hour to hour and a half total time, including going in and out. It's not a long procedure at all. The nature of the recovery. So the biggest issue I found with chin implants is that they can be uncomfortable for the first 1 to 2 days. Using something called Exparel, which is also known as liposomal bupivacaine, has markedly made my patient feel so much more comfortable. It's a long-lasting anesthetic that lasts about 1 to 2 days, 2 to 3 days, 1 to 3 days, roughly that frame of time. So my patients are not very in pain at all. The issue though is because it's numb, it will affect the nerves for the first 2 to 3 days. So you'll be talking a little bit like this for the first 2 to 3 days, but if you don't have much pain, to me it's worth it. It's a much more expensive injectable, but I love using it because my patients don't feel that pain that other places get. In terms of bruising and swelling, most of my patients don't have much bruising and swelling. The reason is for the vast majority of my patients, I use something called TXA or tranexamic acid. TXA is a product that really minimizes bruising to the point where most of my patients have almost no bruising, which is really, really good. And that makes the recovery incredibly fast. If I'm just doing a chin, I don't use drains. I typically don't even wrap the head. And if I do a little neck work, like a little neck liposuction, or whatever it may be, I may be doing a wrap for one night for the head, but I rarely use drains unless I'm doing a facelift with that. Or if I'm doing a deep neck technique, which is a whole different video to begin with. So the chin implant really is a lifelong improvement. It's not something that you have to replace after a few years. After the encapsulation, it's good for many years. The recovery also, because I'm going under the mentalis muscle, for the first 7 to 14 days, sometimes the smile is slightly affected, the speech could be affected. I've seen it as long as 6 weeks, but the vast majority within 7 to 10 days, their speech is fully recovered and back toward normal. And their smile is fully recovered by then. And again, the reason is I'm going under the mentalis muscle. So most people, the recovery is about 7 to 10 days. There is an external incision here. The incision heals very, very well. What I use is a stitch called 7-micron, tiny stitch that is flesh colored, and even African Americans, they typically don't even see this. And it stays there for about 2 to 3 weeks. I don't like trimming them, and the reason is I found that the longer the stitch stays, actually the better the healing. And with this specific stitch called 7-micron, it's very interesting that it doesn't leave track marks, it typically doesn't leave scarring that looks unfavorable. So it leads to better healing, and I don't have to take the stitches out. So my patients that live out of town don't necessarily have to stay a week. They can stay a day or two, fly back, the stitches dissolve after a few weeks, and that's a nice thing as well. Things I recommend afterwards is just to use some scar gels just to make it heal better, like silicone scar gels or silicone scar sheets, both of which I have in my office if you would like that. And rarely do I need an injectable scar dissolver, but sometimes I do just to make it heal as good as possible, well as possible. A lot of people ask, do you go from inside the mouth? There's two ways to approach the incision. You go from inside the mouth or outside the mouth. I never go inside the mouth, and I think the reason is, as I told you, I've only had one infection. It was because I did a lip reduction at the same time, and that may have caused the infection. And also there are nerves right here. I don't like to go through here in places, extend extremely long implant through an infected field to try to do that. The other reason is sometimes I work on the neck, and so for all those reasons, the external incision heals very well. I don't like to go from inside the mouth for those reasons, so I go from an extra oral technique. The other things to know about the implant is, why do the implant? What are some of the benefits you're getting? Well, one is it gives you a much better structure to the chin. The second thing is if you have a more prominent nose, it can make the nose look smaller, so relative balance to the face. The other thing is if you have a relatively shorter neck, it can actually give you an illusion of a longer neck. So there are a lot of benefits to our facial balance. A concern people have is, well, I look like Jay Leno. For those that are very young, they don't even know who he is. But I'm not going to make an incredibly large implant for you. It's just the right size implant that, if done well, will make it look like something that people don't even know it's there. It's like your brain will even forget about it. A couple of limitations of the implant: if you've got a little asymmetry of the chin, you will still see that asymmetry when I'm done with the implant. So you need to know that I cannot make both sides of the chin perfectly identical. That's a limitation. The other thing is, if you feel the edge, even though I use a very beautifully tapered edge, you may still feel a little of the implant, and that's normal. So don't be alarmed by that. I think that's basically some of the key points I want to talk about with chin implant. I encourage you to come and see me. I do a ton of chin implants here, very safely, very elegantly, and very, very beautifully.